Hi, Wendy. Hi, Signe.
Hi,
Hi.
Theresa.
Hi, thanks for coming on. I'm so excited about the conference this year and so appreciative of the two of you and Dr. Shelley Agarwal for being a part of the conference. The past few years that I've done the conference, the first year was on just kind of the basics of eating disorders. Last year was the 2-day conference specifically on eating disorders and internal family systems theory. And this year, with the focus on weight stigma and eating disorders with an IFS lens, I really wanted to kind of weave in all of those aspects to the conference. But for sure, I wanted to be able to offer an adolescent aspect, and which is why I was thrilled that the three of you agreed to do one of the full day breakout sessions, because I think that when a clinician is working with an adolescent, whether they know they have disordered eating or an eating disorder or not, or working with parents who have kids, that being able to talk about these issues and have some awareness about disordered eating, eating disorders is just really vital. So that's why I really wanted to incorporate an adolescent aspect. So thank you. And with that, if you would both just say a few sentences about yourselves, because there'll be people that want to join the conference or come to the conference that might be from the IFS world or not really familiar with the adolescent eating disorder world. So just maybe introduce yourself, and then I'll talk about the overall day of how I'm going to kick off the conference. So Signe, you
I'll
want
go
to?
ahead and start,
Yeah.
and so Shelley's not here with us, but our talk will be multidisciplinary. And Dr. Shelley Agarwal is a medical doctor that's double boarded. So she's a pediatrician and an adolescent medicine subspecialist. So she'll be speaking about the medical considerations. I'm the therapist on the team, one of them. I'm a licensed marriage family therapist as well as certified eating disorder specialist, and body image across the lifespan is a bit of my specialty as well.
Great. Thank you.
and I'm Wendy Sterling, and I am a registered dietitian and a board certified specialist in sports dietetics. And my work really blends the combination of both eating disorders, sports nutrition. I work with adolescents, but I also see adults.
Thank you. Yeah, and I'm glad that you mentioned, Signa, the multidisciplinary approach.
Mhm.
In the outpatient world, I think it's whenever possible, taking that multidisciplinary approach is essential in working with adolescents and adults too, but specifically with adolescents. Um, and that's kind of how we're going to structure your day. I'm going to kick it off doing the first part of the talk, and I'm going to talk about my experience in working with the adolescent population and how it evolved over my career of not really understanding family based therapy, FBT, and then getting trained in it, and also and knowing the nuances of being able to bring in other aspects of therapeutic interventions with working with adolescents with eating disorders, um, and then setting the groundwork for the multidisciplinary team to present the rest of the day. So if you could spend a few minutes just talking, giving a quick overview of what people can expect from your talk, either one of you can jump in.
Okay, Wendy, I'll go. My talk, I'm going to be infusing in some eating disorder interventions.
Right.
My goal is that people will have interventions that they can use right after that, in private practice. And then a bigger part of my talk will be body image. And again, I mentioned that that I specialize in body image across the lifespan, but my focus in this talk will be specifically around body image in adolescence. And there are some things to consider. It's a time of life where the physical changes are more rapid than any other time of life. And it's also a time of life where the teens they're in self-discovery, they're figuring out their identity, and it's a very emotionally rich time of life. And so at any time of life when the emotions are really high, things get imprinted and the brain tags them as extra important. And so we'll be talking about what that looks like as it relates to messages teens are receiving about their body, as well as stories they may be telling themselves about their body and ways that they might reshape that. And then I'll also be adding in, talking a little bit about why body image. Why is it important to bring it in? Um, and we'll be defining body image, speaking about it across a spectrum. And then we'll also talk about how body image is contextual. So just meaning that, it typically changes depending on the environment that we're in. So really it will be all about skills and tools for really helping our teen clients, but of course it could be applied to any age group, build body image resilience. And the last piece that I'll be covering is considerations for body image work. So it really is, there are lots of different ways to do it, but a fair amount of it is CBT, cognitive behavioral therapy. And to be able to do that kind of work, we have to be able to assess our clients and make sure that they have a pattern of good sleep hygiene, as well as fueled adequately and weight restored before we start to do some of that CBT work.
Great, thank you. And I love that you're going to incorporate therapeutic interventions that people can
Mm-hmm.
use right away.
Yep.
Yeah, thanks.
Yeah, so then where I come in as the dietitian is really no matter who I'm seeing, I am really starting with someone to assess whether somebody's diet is adequate, is balanced, and are they doing these things consistently? So we sort of call this their ABCs. And so whether it's an eating disorder or just an energy imbalance, and I'm going to spend some time talking about that. Because in my practice, working with athletes, I also see lots of energy imbalances that are frequently missed or overlooked. And, I'll be talking about a case study with an athlete, D1 athlete who was in a state of energy deficiency, was benched mid-practice, but kind of hard to tell, performing really well initially until she wasn't. Looked like she was eating really well. Kind of hard to tell from just looking initially. Kind of the envy. Her diet was the envy of the team. But there is such a thing as too healthy, not enough of the, balance of nutrients. So we'll be kind of looking at that. And really talking a lot about this idea of what's an energy imbalance and who's at risk. It turns out a lot more people are at risk than I think most people realize. Anyone who's dieting or anyone who, which as we know is a lot of people, but anyone who's training really hard or has allergies or limited preferences or struggling with food insecurity, going through a major life transition. So the list is really long. And then what are those effects on the body and the mood? And then how do we come out of that?
Great. Yeah. And then Dr. Shelley Agarwal will be talking about the adolescent medical piece and part of the days long discussion as well. Yeah.
Yes.
Great. Okay. Well, I don't want to take any more of your time. Thank you so much for joining me. And I'm really looking forward to the talk in April.
Thanks for
Thank you for
having us.
having us. We're so excited to join you. It's a great lineup.
Thank you.
Thank you, Theresa.